Hello, my friends. I'm Dr. Linda Parker, urologist and senior health specialist. And today, we're going to have one of the most important conversations you can hear after the age of 70. Not about new pills to take, but about 5 very standard prescriptions that you absolutely have the right to question if you care about your brain, your memory, and your independence. For decades, many adults have been told a dangerous half-truth: that getting older automatically means more pills, more side effects, and an inevitable decline in memory and clarity. You're told that brain fog, confusion, and forgetfulness are just old age, while prescriptions quietly pile up on the nightstand. But the reality I see in my daily practice is very different. Again and again, I meet men and women whose brains are not failing them because of age alone, but because of how certain medications interact with an aging nervous system. The good news is that when those medications are carefully reviewed, adjusted, or replaced, their clarity, mood, and energy often improve in ways they thought were impossible at their age. Let me set something straight from the beginning. This video is not about demonizing medication. Modern medicine saves lives every day. Blood pressure pills, diabetes medications, heart drugs, and many other therapies can be essential. Stopping them on your own can be very dangerous. What I want to do with you today is different. I want to help you recognize which prescriptions, once considered routine or harmless, deserve a serious second look after 70 because of what they can do to your brain. My goal is not to scare you, but to give you language, questions, and confidence so you can sit with your doctor and say, calmly and clearly, "Is this still the best choice for me, at my age, with my current brain and body?" As we go through these 5 prescriptions, I want you to keep one idea in mind. The older brain is not a weaker brain. It is a more sensitive and valuable brain. It has decades of memories, relationships, skills, and experiences stored in it. But that brain is also less tolerant of sedatives, less tolerant of sudden changes in blood pressure, and less tolerant of medications that block key chemical messengers. When you were 40, you might have tolerated a pill with only minor drowsiness. At 75, the same pill can cause confusion, imbalance, severe brain fog, or even delirium. So the problem is not just the pill. The problem is the mismatch between an aging brain and a prescription that was never adjusted to your current stage of life. Before we dive into the first prescription, one more crucial reminder. Nothing I say here is a replacement for medical consultation. Please never throw away a pill, cut it in half, or skip doses on your own because of a video. What I want to give you is a flashlight, not a hammer. A flashlight so you can see which areas of your medication list deserve a careful, respectful conversation with your doctor or pharmacist. That's how you protect your brain safely and intelligently. Let's begin with prescription number 1 to question after 70, the classic pill for sleep and anxiety. You know the story. Years ago, maybe in your 50s or early 60s, stress at work, caregiving, or menopause made it hard to sleep. Your doctor gave you a small pill just to help you relax. Maybe it was presented as something to use only for bad nights, but as life got busier and worries grew, that occasional pill became an every-night habit. Now you're 72, you don't even remember when you started it, and you feel you can't sleep without it. These medications often belong to a family of sedatives that slow down your nervous system. Some are officially for anxiety, others for insomnia. On paper, they look helpful. They quiet the brain, dissolve tension, and bring on sleep. But in the older brain, their effect is very different from what most people expect. Instead of natural, restorative sleep, they often produce a drugged sleep that robs you of deep stages of rest. Instead of calming mild anxiety, they can leave you foggy, unsteady, and forgetful. Many seniors describe it this way: "My body is on autopilot, but my mind feels like it's under a heavy blanket. Why is this such a brain health warning after 70? First, these sedatives slow down reaction time and coordination. That means higher risk of falls, fractures, and head injuries. A fall that you could have caught yourself from at 50 can become a life-changing event at 75 if your reflexes are dulled by medication. Second, they interfere with memory formation. You may notice that you repeat questions, misplace objects more often, or forget conversations from the day before. What worries me deeply is that this memory change is often blamed on aging instead of on the pill that is quietly slowing down the brain. There is also the problem of dependence. When the brain has relied on a sedative for years, it adapts. Trying to stop suddenly can trigger rebound insomnia, intense anxiety, or even withdrawal symptoms. That's why I will repeat this several times. Never stop these medications abruptly on your own. The solution is not to suffer in silence or to pretend everything is fine. The solution is to sit down with your doctor and ask, at my age, do the benefits of this sleep or anxiety pill still outweigh the risks to my brain? Is there a plan to slowly reduce it? Are there safer strategies for my sleep or my anxiety now? Often, there are many alternatives. Cognitive behavioral therapy for insomnia, gentle relaxation techniques, breathing exercises, structured daytime routines, light exposure in the morning, and in some cases, milder medication options or adjusted doses. The key is not to accept the phrase, "You've been on it forever, let's just keep it. You deserve a fresh evaluation." Now let's move to prescription number 2, to question after 70. The overactive bladder pill with strong drying effects. As a urologist, I see this every single day. A patient in their late 60s starts having urgency, frequent trips to the bathroom, or leakage when they can't get there in time. Their doctor prescribes a medication that calms the bladder. Over time, their mouth becomes dry, their eyes feel gritty, constipation worsens, and something even more concerning starts to appear. Confusion, trouble concentrating, difficulty finding words. Many of these bladder medications work by blocking a chemical messenger called acetylcholine. Acetylcholine is not only involved in bladder contractions, it is also crucial for memory, attention, and learning. In younger adults, the brain can often handle a certain amount of this blocking effect. In older adults, especially those who already have mild memory issues, blocking acetylcholine can be like turning down the volume on the very signal that keeps thinking sharp. This group of medications belongs to what we call anticholinergic drugs. They don't just dry the bladder, they dry the brain in the sense that they reduce its ability to communicate quickly and clearly. People may notice increased forgetfulness, slower thinking, confusion in unfamiliar places, or even episodes of delirium when the body is under stress from infection or dehydration. What troubles me is that families often assume that dementia is progressing, when in reality, a high anticholinergic burden from medications could be part of the problem. If you are taking a pill for overactive bladder, especially if you also use other drugs that cause dry mouth, constipation, or blurred vision, it's time to ask your doctor important questions. Is this the safest option for my age? Are there non-drug strategies we haven't fully tried, such as pelvic floor therapy, bladder training, reducing irritant drinks like caffeine and alcohol, or adjusting fluid timing? Are there newer bladder medications that act by different mechanisms with less impact on the brain? Sometimes a simple switch or a dose reduction can make a remarkable difference in clarity and alertness. Prescription number 3 to question after 70 is the long-term, strong painkiller for chronic pain. Chronic pain is real, and it can be devastating. Arthritis, spinal problems, nerve damage, and old injuries can make every step difficult and every night restless. For many years, the answer was to prescribe powerful pain relievers. Some target the pain pathways in the brain and spinal cord. Others act on nerve signaling more broadly. Initially, these medications may feel like a miracle. Pain is reduced, sleep is better, mood lifts. But over months and years, the picture can change. In the older brain, strong painkillers often bring a heavy cost in terms of attention, balance, and memory. You may notice slower thinking, emotional flattening, and difficulty following conversations or instructions. The brain can become so used to the drug that it needs more to get the same effect, increasing the risk of overdose, severe constipation, breathing problems, and debilitating fatigue. Even medications often labeled as nerve pain pills can contribute to dizziness, confusion, and falls in seniors. Again, the message is not that all pain medication is bad. Pain itself is a brain health issue because constant suffering drains energy, worsens sleep, and increases the risk of depression. But chronic, high-dose use of strong painkillers without regular review can slowly erode the very independence you want to protect. If you are over 70 and have been on the same strong pain prescription for years, I encourage you to ask, are there non-drug or lower-risk options we could explore? Could I work with a pain specialist or physical therapist? Is my current dose still appropriate? Or could we try a gradual reduction while adding other strategies like targeted exercises, heat therapy, joint-friendly movement, or mindfulness-based pain management? Many patients are surprised to discover that a combination of gentler medications, movement, and behavioral strategies can provide acceptable pain control with far less impact on their thinking. The goal is not to be heroic and endure pain without help. The goal is to reduce reliance on medications that sedate the brain and increase reliance on approaches that support both the body and the mind. Let's move on to prescription number 4, to question after 70. The forever acid reflux pill taken daily for years. Many older adults were started on strong stomach acid blockers, often during a stressful season, after a hospital stay, or alongside other medications that irritate the stomach. These drugs can be very useful in the short term. They allow ulcers to heal, reduce severe heartburn, and protect the stomach from injury. The problem appears when a temporary solution quietly becomes a permanent habit. Strong acid blockers reduce stomach acid production. While that protects the stomach lining, stomach acid also plays an important role in absorbing certain nutrients from food, especially vitamin B12 and minerals like magnesium. Over many years, reduced absorption can contribute to deficiencies that affect the brain. Low B12, for example, is linked to memory problems, numbness, balance issues, and mood changes. Low magnesium can increase muscle weakness, cramps, and in some cases, abnormal heart rhythms that affect overall brain and body function. You may not feel any stomach symptoms while taking these medications, so it's easy to assume everything is fine. But if you're over 70 and have been on a strong acid blocker for a long time, it's wise to ask your doctor, do I still need this every day? Could we check my vitamin B12 and magnesium levels? Is there a plan to see if a lower dose, intermittent use, or lifestyle changes, like adjusting meal timing, avoiding late-night heavy dinners, reducing trigger foods, or elevating the head of the bed, could keep my symptoms controlled without such constant suppression of stomach acid? In some cases, the answer will be, yes, you truly need this medication, especially if you have a history of severe ulcers or certain high-risk conditions. But you deserve clarity, not autopilot prescribing. Protecting your brain includes protecting the nutrients that feed it. Finally, let's talk about prescription number 5, to question after 70. Overly aggressive blood pressure or heart rate medications that push you too low. High blood pressure is a silent threat to the brain. It damages blood vessels, increases the risk of strokes, and accelerates small vessel disease that can lead to vascular dementia. For that reason, treating high blood pressure is extremely important at every age. However, in older adults, it's possible to swing too far in the other direction. When blood pressure or heart rate is pushed too low, the brain may not receive enough steady blood flow, especially when standing up or changing position. This can cause dizziness, lightheadedness, near fainting, or actual fainting spells. Over time, repeated episodes of low blood pressure and reduced brain perfusion may contribute to cognitive problems. Many seniors describe feeling washed out, mentally slow, or not quite there when their pressure runs on the low side. They may also be taking several blood pressure medications at once, prescribed at different times, without anyone regularly checking how they interact. If you are over 70 and take multiple pills for blood pressure or heart rhythm, pay close attention to how you feel when you stand. Do you need to hold on to furniture for several seconds? Do you feel like your vision dims for a moment? Have you had unexplained falls or episodes where you lost time? These are not just clumsy moments. They are important signals. Bring them to your doctor and ask, could my blood pressure or heart medications be too strong for me now? Can we check my readings lying down and standing up? Is there room to adjust doses so we protect my heart and brain without starving my brain of blood flow? Adjusting these medications is a delicate process and must be done under medical supervision. But the principle is simple. The target numbers for blood pressure and heart rate in a frail 80-year-old are not necessarily the same as those for a healthy 50-year-old. Your brain deserves a personalized range that balances protection from strokes with protection from dizziness, confusion, and falls. At this point, you may be thinking, all right, Dr. Parker, I recognize myself in more than one of these categories. What do I actually do with this information? Let me give you a practical roadmap. First, gather all your medications in one place: prescriptions, over-the-counter pills, supplements, and herbal products. Put them into a bag or list them carefully on paper, including doses and how often you take them. Many hidden brain risks come not from a single prescription, but from combinations. For example, a bladder pill, a nighttime sleep aid, and an allergy tablet, all with anticholinergic or sedative effects. Second, schedule an appointment specifically to review your medications. Tell your doctor in advance that your main goal is to protect your brain while staying safe. Use simple questions like, which of these are essential for my survival? Which are protecting an important organ? Which were started for a temporary problem that may have resolved? Third, be open to gradual change. Most brain-harming medications cannot be stopped abruptly without consequences. A thoughtful taper, often over weeks or months, is far safer and more realistic. During this process, non-drug strategies become especially important. Improving sleep hygiene, staying hydrated, moving your body daily, protecting your hearing and vision, and staying mentally and socially engaged. These are powerful tools for brain health that never appear on a prescription pad. Let me share a brief story that captures what is possible. A 78-year-old gentleman came to see me with his daughter. He was on a sleep pill, a bladder pill, strong pain medication, and an acid blocker. His family was terrified he was sliding into dementia. He repeated the same stories, forgot appointments, and seemed lost in familiar places. Instead of immediately labeling it as irreversible, we went through his medications slowly. Over several months, working closely with his primary doctor, we reduced his sedative at night, switched his bladder medication to a gentler option, adjusted his pain plan, and reassessed his need for the acid blocker. The transformation was remarkable. His daughter later told me, with tears in her eyes, "It's like my father's personality came back." Was he suddenly 30 again? Of course not. He still had some memory lapses, and he still needed support. But his clarity, humor, and engagement improved enough that he could enjoy conversations, tell jokes, and participate in family decisions. That is the kind of victory that matters after 70. Not chasing perfection, but reclaiming the quality of life that excessive medication was quietly stealing. If I had to compress everything we've talked about into one sentence, it would be this: After 70, every pill must justify its place in your life, especially when it comes to your brain. That single line holds an entire philosophy. You are not a passive recipient of prescriptions. You are the guardian of your mind, your stories, your independence. And here is the hopeful truth I want to leave you with. It is never too late to protect your brain. Whether you are 70, 80, or beyond, your nervous system still responds to better choices, careful adjustments, and respectful treatment. Questioning a prescription is not a sign of rebellion. It is a sign of wisdom. You have earned the right to ask, why? And to hear a clear, respectful answer. If this conversation resonated with you, I invite you to take one small action today. Look at your pill box with new eyes. Choose one medication from the 5 categories we discussed and write down the questions you want to ask about it. Share this video with a friend, a sibling, or a caregiver who is also navigating life after 70. These conversations can change not only individual lives, but entire families. And if you'd like to keep learning how to protect your vitality, your circulation, your brain, and your well-being in the later decades of life, I'd be honored to have you here. Subscribe, leave a comment about which prescription you plan to discuss with your doctor, and let's continue building a community where aging means clarity, dignity, and strength, not a quiet surrender to unnecessary medication. I'm Dr. Linda Parker, thanking you for your time, your trust, and your courage. Remember, your brain is your most precious organ. Guard it wisely, and it will continue to serve you, to connect you, and to express who you are, no matter how many birthdays you've celebrated.